So this is a 3D model of the twins. It's obviously a miniaturized version. It shows their anatomy. We can tell who's who by Jamie having a straight spine, while Amy on this side having the scoliotic spine. When you look at the representations of the viscera, this large transparent structure here is the shared liver. And then, of course, within the rib cage are the lungs on both sides and the heart, which is covered in the pericardial sac. So in the actual procedure, when we started, we were in this position, we made the curved incision, and then we went down to the fascia, elevated the fascia, started by dividing the conjoined liver by dissecting around it, Dr. Iglesias and Dr. Knott, dissected around it, and then went all the way through till the liver was separated. To do this, they packed the intestines away, which are not represented in this model. And then they went ahead, obviously what's missing here is the shared breastbone. They went ahead and divided the shared breastbone in the ribs and went around and through the pericardial sac around the hearts. They're very careful to keep the lung sacs separate so that we don't get any air around the lungs, and did that all the way till they came through on the other side. So when everything was completely separated, including the fascia on this other side, we basically lifted the babies up and then made the back incision, and that's how they became two separate individuals. The rest of the procedure basically involved each baby laying on their back, baby Amy being transferred to another bed, and baby Jamie staying on the bed which we're working. And then the other procedures involved repairing the diaphragm, which is covering between the abdomen and between the chest and the abdomen, and then repairing the abdominal wall fascia, and then closing the skin for Jamie. For Amy, the diaphragm was repaired as well. The abdominal wall fascia was repaired, but there was too much tension to close the skin, so a temporary wound vac dressing was placed on Amy. And everything went great.